So what does it truly take to match as a non-US IMG? So whenever I ask this question, so IMG, there's a lot of answers, but usually they kind of like joke around. They said that where it's gonna be blood, sweat, and tears, or persistence, or a lot of luck. But seriously, what it really takes to match as a non-US IMG. The reason why this question is so important because there's a lot of IMGs actually walking through this journey having the wrong mindset and having the wrong idea on what it truly takes to match. Now, the first mentality that is very common is that I just need to get as high of a score as possible in USMLE Step 2 CK. Now, I don't think that is like completely wrong. I think that's kind of like more applicable in the past than now. The reason is because the step 1 has become pass and fail, and so we use the step 2 CK. And I think that shifts leads to basically the score is not the main component anymore, even though that's still statistically significantly affecting your chance of matching. You just have to go to the NRMP data and you'll be able to see it for yourself. If you have a USMLE Step 2 CK score of 250 and above, and let's say you are aiming for the internal medicine residency, as a non-US IMG, your chance is roughly about 60%, which is actually much better than if your score is like 220 or 210, then your chance of matching is kind of become way lower to 40-30%. But the number makes sense, like 60%. So I guess my question is, have you ever seen someone who got 260, 270 and didn't match? I'm pretty sure you have. Have you ever seen people who just score of 210 and 220 and match? Of course, I'm pretty sure you have seen that before. I have seen people who failed step 1, failed step 2 CK, and still able to match. Now, another mentality of IMG usually like, I'm gonna do a lot of research. I'm gonna strengthen my CV by doing a lot of research, doing a lot of publications. Well, here's the thing. Have you seen people who just doing case reports, maybe 2 or 3 case reports, and not the real publications and match? Yes. And have you seen people who does a lot of publications and then still don't match? And the answer is also yes, right? So that is not it either. And of course, number of interviews matters a lot. Usually if you got good number of interviews, the chances are more likely for you to match. But you have seen people who have good number of interviews. Like nowadays, if you have above 5, like 7 or 8, that's actually pretty good. And they didn't match. I've seen it before, right? People who have a good number of interviews didn't match. And I've seen people who have just 1 interview and they match. So what is it? What is the secret? What does it truly take for non-US IMGs to match? And actually just come down to this one thing. Become the kind of physician that people want to work with. That's it. Become the kind of physician people want to work with. So now it makes sense. There are people who got score of 260, 270, couple number of interviews. They invited for the interview, but during the interview, the programs or whoever the interviewer is think that they can't work with you. They just don't want and they don't think that they can really work with you. And so you don't match. But there are people who maybe score less or low, or maybe failed, and maybe they got a chance of doing rotations in a residency program and they love this individual and they would want to work with him or her. And so they match, right? So it all comes down to that. But the questions now become, how do I become the kind of physicians that people want to work with? And the answer is to have the skills and traits or attributes of a high quality US physicians. And what are those attributes? Well, it's gonna be the balance between the hard skills and the soft skills. The hard skills are, of course, raw medical knowledge, and that's why scores is important, right? But beyond that, as a non-US IMG, the hard skills would be something like, are you familiar with the US healthcare system, or how it works? Are you familiar with the EMR? Can you operate with the EMR? Can you extract information accurately from the chart and also from the patient? And are you able to present the case accurately to the attending? So those are very important hard skills that you want to have as a non-US IMG, and the program directors value it very highly. The other one would be the soft skills, and soft skills would be simply communication and interpersonal skills, like how fluent you're speaking, how comfortable you are expressing your thoughts and ideas. Does the patients actually love you when you're interacting with them? Does the colleagues happy with you? Does the nurses actually like you? Are you a likable person? Are you a positive mindset person? And all of these things are traits of a high quality US physicians. Now, I mentioned in the very beginning of this video that a lot of non-US IMG have the wrong mindset because they treat the match as if a paperwork, a visa applications, right? So during the visa applications, you will need your passport ready, your form ready, your bank statement ready, and then here you go, you apply it. And a lot of IMGs do it that way, and they think like, oh, okay, I need my USMLE score, I need my ACFMG certifications, I would also need my USCE 3-6 months, I need a 4 letter of recommendations, I need 3-4 researches, and then here you go. No, that is not how the match works. The whole idea here is that the program director sees the accomplishment, achievements to predict who are the person behind the paper. So if you have completed the USCE maybe 3 to 6 months, and if it's a hands-on experience, they expect that you're gonna be quite good at doing a chart review, or hey, you have done presenting cases before and your English would be much more fluent than somebody who never done USCE before. Those are really the expectations. And if they see a USMLE score that is high, like 260, 270, they will expect that you have a really good medical knowledge, which is actually true. It's very, very correlated. I have students, IMGs, that rotate with me in my office. I can easily tell you who hasn't done step 1, who has completed step 1, who has completed step 2, who has a low score in step 2, and who has a high score in step 2. It's very clear. I can really see the differences between those. So yes, of course, that is correlated, but there is just some things that are not really correlated. Like, so if you are only doing publications for the sake of having your name on top of a paper and not having the ability to do the research, then there is no real point on doing those research. The idea is, again, the program director is looking for the person behind that paper. They just expect that if you have some form of these achievements, they're hoping, and at least they're gonna expect, that the person behind those papers are great, having the attributes and skills of a high quality US physicians. Here, let me give you an analogy. Let's say you want to become a champion, let's say playing tennis, right? What do you need to do? Well, of course, you're gonna get the registration form and then put your name on it and then submit it to the tournament so you can play inside the tournament and probably pay the administration fee and such, and so you can play, right? But that's not going to make you the champion, right? In order for you to become a champion, then you want to make sure that you have a good forehand strokes, okay, a strong, solid backhand strokes, maybe the volleys, maybe the serves. You want to have a really good footwork. You want to be fast, right? So if you have all those skills and the attributes of a tennis champion, then once you have that, you join the tournament, you'll naturally become the champion. That champion has become the natural consequences of all the skills and attributes that you have built over the years. The match is pretty much the same. Once you have mastered the communication skills, your ability to chart review, your medical knowledge, and all of this, then the match should be the natural outcome. So now what I want you to do is this. Imagine yourself, what would be the ideal physician looks like to you? What kind of skills or traits do they have? Think of maybe 3 main traits, skills, attributes of an ideal physician's of your vision. Once you figure that out, then the next thing is try to think, what are the things or steps that I need to do so I can have those skills, right? So I can have those attributes. Now, here's the last concept that I want to share with you in this video, the concept of additive gain and compounding gain. When you walk through the journey, there are things that you will do that will improve yourself. To make the conversation very, very simple, additive gain are the things that just make you look good on paper, right? I have completed my USCE, or I have completed I probably do 2 or 3 research, then I can put on a CRES CV. I have done this and done that. Now those are basically additive gain. Compounding gain are the skills or attributes that you master throughout your journey that would be compounded towards the ideal physicians that you have in your mind in the future. So in my case, this would be the ability to express your thoughts, communications, right? Or even as simple as having a positive attitude, having a positive mindset, be calm and composed. Those are all compounding gains, you see that? Because when you master those skills, a lot of the areas improve automatically. You will have a successful USCE, people are going to love you, you're going to get a strong letter of recommendations, and your interview skills is also improve, right? So these are the things that will improve so many things, and that's why they're compounded. I also can give you an example when you're studying for USMLE. Completing UWorld is an additive gain. I complete 100% of UWorld. That doesn't actually mean much. Yes, you have become more than you were before, but just looking at completion of the UWorld is just an additive gain. Compounding gain on studying USMLE would be your time management, right? Your ability to stay calm and composed during the test, during the exam. Maybe your ability to schedule the time on when you should study, when you should sleep, when you should exercise, right? The time management, not only time management during the test, but time management on your life. Because if you are able to be disciplined and manage your time really, really well, then of course it improves a lot of areas of your life, like everything, right? Not only for the exam itself, but then you have time to find the right USCE, for example. Your minds are more clear, right? So there's a lot of components, a lot of things that improve at the same time by doing that. Getting a Zanki deck, a pre-made decks, right? And then studying them is like additive gain. But if you learn how to actually use Anki flashcards, how to be organized in that, how to create an efficient card that has a lot of concepts in it, that's a compounding gain. Because now you can use it for USMLE Step 1, 2 CK, 3, the boards, and also when you're studying medicine during your rotations and also during the residency. You see that? Okay, that are the things that can carve your way into becoming a high quality physicians, the ideal form in your mind. So the bottom line is, what it truly takes for non-US IMG to match is to become the kind of physician people want to work with. And in order to do that, you have to become a high quality US physicians. Think about all the attributes that is needed to achieve that and work your way to achieve it. Focus a lot on compounding gains, things that will improve a lot of things at the same time that would help you reach that goal rather than the additive gain. Now, if this video is resonating with you, if the ideas of this is resonating with you, I would like to invite you to join my clinical mentorship program at Networking Opportunities. Because the goal of my mentorship program is to help non-US IMG to become the kind of physician people want to work with. It's that simple, right? So in my clinical mentorship program, I teach communication and interpersonal skills, cross-cultural communications for non-US IMG, how to chart review. Every week I run networking events with IMGs who are successfully matched in residency, and they share their journey, information, inspire you. And on top of that, I also run morning reports, help improve your medical knowledge, everything that you need so you can become that high quality physicians that people want to work with. If you like to join, just click link down description below. I will put that in the comment as well, and it will bring you to a page, and just put your name and email address. There'll be video sent to you, and it will explain everything about the mentorship program. That's the video for today. I'll see you again for more USMLE and residency matching tips. Bye now.